Hi, I'm Junice Melgar. I'm a medical doctor from the Philippines working with a women's health organization called Likaan. This work actually entails organizing women, helping them help their communities. It also entails running women's clinics that respond to women's particular health problems, including reproductive health. And it also includes advocating for policy changes at the national and local level so that there would be programs and services for poor women and their families.
And what's the link between Interpares and Likan?
Interpares has been one of the longtime partners of Likaan, helping us for the past 21 years. And one of the few, if not the only, organization helping poor women actually realize their potentials, especially as agents of change for their community. The reproductive health law is a law that actually makes sure that women who are pregnant get the care that they need so that they do not die in pregnancy. And it also allows them to have contraceptive services so that they can plan only the children that they want to have at the time that they want to have it. And the last big provision of the law is allowing minors, adolescents, to have sexuality education so that they are able to care for themselves, they're able to ward off abuse, and that they can also decide for themselves about pregnancy and contraception. So these are the three big things contained in the reproductive health law. But it took 4 Congresses and 14 years to pass this law, and actually 1 more year for the Supreme Court to allow it.
And why is it so important for the Philippines?
This law is very important in the Philippines, where over 4,000 women are dying every year from pregnancy complications, which are all preventable. All deaths are preventable. And also because there is a rising incidence of teen pregnancy. We have the highest in Southeast Asia. And we have a growing problem of HIV among young people, described as a fast and furious pace. So this reproductive health law is meant actually to arm our women and young people with services that could help them avert death, but also to make them run their own lives and look for a healthier future for themselves.
So now, what do you think will be the challenges to implement that law?
There are bigger challenges after passing the law. We still expect opposition, so that already as the law is being implemented, it's being challenged by the religious opposition. The other challenge is that our health system is poorly funded, so that means we need to look for resources from taxes, from the Philippine Social Insurance, so that the reproductive health does not just become a law, but becomes a real program, especially working for the poor. There are many ways that Likaan can help make sure that the implementation goes well. The first of our assets are the community-based women in the community-based programs, because these women are so empowered. They know actually how to challenge their own local health systems, their local providers, their local governments, to make sure that they have working reproductive health programs on the ground. We also have a big network of reproductive health friends and network of activists that we work with at the national level, so that whatever implementation we get at our communities gets implemented at the national level, nationwide. And most importantly, we have friends also, policymakers in health with a social insurance that will make sure that policies are there and that the government system at the various levels are responding to the needs of women and their families.
You talked a little bit about the challenges of a fragmented system in the Philippines. Can you give a specific example of that?
The Philippines, for example, devolution is very extreme. It's an extreme experimentation in the Philippines. It was actually a response to the centralized government during the dictatorship. So it's, in principle, it's supposed to put health in the hands of the people, but it's so severe that, for example, a local government unit that does not want reproductive health can actually insist on depriving them of these services, and national government cannot compel them to comply with international standards of family planning as a basic human right. So that's one problem. A local government unit may also be too poor, so that even if it wanted to, it could not supply the services. But there is no mechanism whereby other richer or better off local government units could assist these poorer communities. So depending on the ability and the willingness of the local health systems, citizens may or may not be able to get the services that they want.
So now, given what you know about the Canadian health system, what will you bring back to the Philippines, and what do you think is maybe a challenge that we are facing here in Canada that you might not have in the Philippines?
Okay. The Philippines has always looked on Canada as an example of a strong public health system, which we don't have in the Philippines. The Philippine health system is part private and small, public, poorly funded. But here in Canada, we see that at the national and local levels, you have a very strong national government-run program, whether it's from the national and all the way to your provinces. We know that you have social insurance coverage for much of your health needs, and that your system and your benefits of your system are even much better than the US, which is the most expensive health system that I have come across. So that we would actually look into what inspired the right to health approach in Canada that is there, that is withstanding like the assault of even big corporations like the pharma corporations, the tendency to privatize the healthcare. That is a struggle that you have, but you have been able to resisting those factors. Those are encroaching factors in the Philippines. So it would be very good. In fact, it's been very helpful to me to learn about the strategies that the Canadian for Health NGO has been working here to make sure that health becomes a human right, remains a human right for all peoples, whether you're poor, whether you're elderly, whether you're a member of the indigenous groups, etc. All people should have health in equal measure.